I'll be offering social studies, biology, geography. Like, share and subscribe for more videos. Welcome to Angie Academy. So we are continuing with nutrition. Today we are looking at nutritional deficiency diseases. So we start with kwashiorkor, however you can pronounce it, as long as you write the correct spelling. Okay, so kwashiorkor is a disease that is caused by lack of enough proteins in the diet. So if a child doesn't eat enough proteins, a child can have kwashiorkor. So this disease mainly affects children. Now let's look at the signs and symptoms. So we have an extended stomach. The stomach becomes big, and when a child's stomach becomes big, as in big than normal, the mother should worry and take this child to the clinic. So when the child is taken to the clinic, the nurses can diagnose the deficiency and also advise the mother. Very good. Then also the child will have diarrhea, will be having diarrhea most of the times if the child has got kwashiorkor. Then we also have retarded growth or stunted growth. A child doesn't grow. Instead of a child becoming taller, the child does not become tall. So that could be one of the signs that a child is lacking some proteins. Then the child will always have fatigue. The child will always be feeling tired. Even without going to play, the child will just be tired. And as a result, the child will want always to be sleeping. Then the child can also have skin rashes. The child will just have a rash from time to time. Then the skin pigment becomes lighter. Not because the child has become light because she's eating well, no, but because it is a sickness. That's why the skin color changes. Then decreased muscle mass. The child becomes smaller or thinner. Very good. Okay, we move to scurvy. So scurvy is a disease which is caused by lack of enough vitamin C. And in the previous video we talked about vitamin C. We said that fruits and vegetables contain vitamin C. So if an elderly person or a child does not eat enough vegetables or eat enough fruits, then they can be prone to scurvy. So scurvy is a rare disease, but it occurs in some patients, usually elderly people or people who live on a diet that lacks fruits and vegetables. Usually why it affects elderly people is because when somebody is growing older, they like eating good foods, as in you want to eat meat kind of food. So as a result, because they're not eating vegetables, they're not eating fruits, they can have scurvy. And also what we have discovered is that mainly as children are growing up, they don't like eating vegetables. Mainly they prefer to eat soup for beans or even chicken and eggs, but they don't like eating vegetables. So these are the people who are likely to get sick of scurvy. Very good. Now let's look at the signs and symptoms. So one of the signs is bleeding gums. When you see a child having the gums that are bleeding, or an elderly person whose gums are bleeding, you should suspect this person as having scurvy. So as soon as you see that, you need to take this person to the hospital. Then there is rapid breathing very fast, as if someone is being chased or someone is afraid. So when you discover that a child or an elderly person or somebody is breathing very fast, and especially that they don't eat vegetables or fruits, then that one is a suspect of scurvy. Then loss of appetite. They don't want to eat because the disease has taken control of them and they lose appetite. Then oftentimes they are tired or they are fatigued. They don't want to do any activity because they are already feeling tired. Okay, so we move to rickets. So rickets is a deficiency disease that cause softening and weakening of bones, especially in children. It is caused by prolonged lack of vitamin D. And in the previous video, we talked about some basking for you to receive vitamin D, and also drinking milk. So if a child does not drink milk, you will discover that this child is going to have rickets. These are the people who normally have legs that are like this, or in November they call amangobe. Yeah, those are the ones. Let's look at the signs and symptoms of rickets. So bowed legs or knocked knees. You can see that the legs are not straight the way they are supposed to be. So when you see a child who looks like that, then you should suspect that this one lacks vitamin D. Then the bones also pain. Usually the bones constantly have pain because they are not strong. Then impaired growth and short stature. The child does not grow. The length at which a child is expected to reach does not reach because of lack of vitamin D. Then this person normally has dental problems such as teeth deformation. You have papanad tooth, or the teeth that are not just straight in the mouth, and also delayed teeth formation. So instead of the teeth being formed, especially starting from 6 months going upward, you find that this child's teeth is delayed because the child is having suffering from rickets. Then soft and weak bones that are prone to fractures since they are fragile. So all the time, maybe a child falls, the child breaks their hand, the child breaks their leg. It's because this child's bones are not strong. So when a child is suffering from rickets, you discover that oftentimes when they fall, they will have injured themselves. Okay, so we go to marasmus. Now, marasmus is a deficiency disease that is caused by almost lack of all the nutrients in the diet, but especially if a child is missing energy-giving foods. We talked about energy-giving foods. These are foods that contain carbohydrates, such as our usual shima, rice, all those. So if a child does not eat enough carbohydrates, and even maybe the child doesn't eat other nutrients, then this child will have marasmus. Very good. Let's look at the signs and symptoms. Number 1, retarded growth or stunted growth. So the child's stature kind of remains at the same level. The child does not grow. So when you see that the child is not growing, then you should suspect that this is marasmus. Then chronic diarrhea. The child will have diarrhea almost every day, and this will cause the child to be fatigued. When you lose too much water in your body, you feel tired all the time. So those are some of the signs of marasmus. Then we will have severe weight loss. That makes the child to look skinny. Since the child does not be eating foods that contain carbohydrate, and this child is also having diarrhea, the child is going to lose weight and it will become very, very skinny, such that when you touch the skin, it just goes like that and goes back and does not even have energy. Then also the child can have paralysis of the legs. The child can be paralyzed, so the legs will stop working. We go to anemia. I'm sure you have heard of people who are anemic, and sometimes when you have malaria, they will tell you that you are anemic. But the anemia that comes after malaria is because of the parasites of malaria. But now this specific anemia we're talking about is because of a deficiency of iron. So anemia is a deficient disease that is caused by lack of enough iron in the body. Now, when you don't have enough iron in the body, this affects the number of red blood cells, hence interfering with the transportation of oxygen in the body. So what happens is The red blood cells that are in a person who is anemic, they are sickle shaped. They are more like a sickle. That's what we use when you are cutting, not grass. Yeah, some use it for cutting grass. But edge, yeah. The way it is shaped, like a C, that's how the red blood cells of this particular person is also shaped. And if it is shaped like that, it does not carry enough oxygen. So a person will be lacking oxygen in his or her body. Very good. Now, let us look at the signs and symptoms. So there is unusual heartbeats. The way your heart beats, it is supposed to beat accordingly. I think it's 78 beats per second, per minute? Per minute, yeah. Now, this time, since you have anemia, the heart beats unusual, or it is even much faster than normal. Then there is also shortness of breath, where a person is more like galloping, as in gasping of air. That's a shortness of breath. The person will be failing to breathe properly. Then a person always has fatigue. A person feels tired oftentimes. Then they also have headaches. They mainly feel dizzy, and you find that most of the times they will faint. Maybe they are not even supposed to involve themselves in most strenuous activities like playing football, because they are often feeling dizzy, so they can fall down and collapse. Some can even collapse to death. Pale skin, the skin becomes light. Not light because you are using the cream for bleaching your skin, no, but because you are lacking iron in your body. Then they have insomnia. Insomnia, this is lack of enough sleep. In the night, the child will just be turning on the bed, turn this side, the other side, just like that. So when a mother discovers that the child does not sleep in the night, then they should suspect that the baby might be having anemia and should be taken to the hospital. Then there is also difficulty in concentration. Some of these children, when they grow up, maybe in school, they do not concentrate. The teacher is teaching, they can't concentrate, they can't sit on the chair for a long time, they are just fidgeting. So those are some of the signs of a person who is suffering from anemia. Actually, the ones who are called carriers, they live long, but those ones who are really having anemia, some of them do not even reach the age of 18. Some, when they reach the age of 18, they don't manage to reach the age of 30. So it is a very dangerous disease, and that's why you children, especially you grade 8, you are supposed to eat foods that contain iron. Very good. Okay, so now let's look at the importance of under 5 clinic. Why should mothers take their children for under 5 clinics? So it is quite important because there are so many things that mothers learn at under 5 clinics. But even before taking the child to under 5 clinic, when the mother is pregnant, she needs to every month take herself to the clinic for checkup. Now, when a child is born, the mother is given an under 5 clinic card. So on this card, there are several stuff there, several things, such as immunization program, the weight of the child, and also the vaccines that the child is supposed to receive. So now let's look at the importance of taking a child to under 5 clinic card. Under 5 clinic. Okay, so providing nutritional advice. So mothers are given advice on type of nutrients to be included in a child's diet. Since we are from looking at the deficiencies diseases that mainly affect children. So when a mother takes the child to the clinic and the nurses or doctors discover that the child has a deficiency disease such as kwashiorkor, the doctors know that this child lacks proteins in the diet. So they will give advice to the mother to be feeding this baby foods that contain what? Proteins. Very good. Then also providing supplements. So when a child has been diagnosed with a certain deficiency disease, the children will be given food supplements. Usually I've seen mothers coming with little bottles of porridge from the clinic when they find that maybe a child has got marasmus or a child has got kwashiorkor. So they are given supplements or food that contains the specific nutrient that this child is supposed to take or to eat. Very good. Also, at under 5 clinics, they monitor the growth of a child. So growth monitoring is done at under 5 clinics. Nurses as well as doctors will take note of the growth of the baby. That is, if the baby is growing normally, or the child is underweight, or the child is overweight. And if the child is overweight, which means that the mother is feeding the baby too much food, especially those that contain carbohydrates. And if the child is underweight, it means that the child is not being fed properly. So the mother will be given advice on the type of food to feed this child, or on the if the child is overweight, to reduce on certain foods that the child is being fed on. Then also it is during these under 5 clinics that children are immunized. So this is giving of medicine to children to prevent certain diseases, or to prevent would-be diseases, the diseases that might come in the future. So there are some diseases that mainly attack Africa or tropical countries, or countries that are found in between the tropics. That lesson is for geography now, so let us concentrate in science. But anyways, there are some diseases that are found in tropic countries, such as polio, tuberculosis, tetanus, or even whooping cough. So they have discovered that they can actually give medicine to children to prevent them from having these sicknesses. I think, like for now in our country, in Zambia, if there is any child having polio, okay, maybe they could be there, but at most there are no children anymore who are suffering from polio, because children are immunized. They are given vaccines. So the vaccines can vary. They can be those ones for injection. They can also be those ones for taking orally. And also, if maybe a child is lacking some vitamins, there are some vitamins like vitamin A that are in more like tablets form. So they would ask the mother to give the baby this vitamin. The child just licks and it sungunukas in the mouth. It melts in the mouth, and that way they can help this child or these children. So on the under 5 clinic card, you also find that a child's weight is measured in mass. So if the child's weight is normal, you will be able to tell, or you are able to tell, especially the nurses, but also the mothers are told that this weight of this child is not a good weight, or this is a normal weight, or this is underweight. And if there is need for a mother to be given advice, a mother is given advice. So from the very first day a child is born, every month a child is supposed to be taken to the clinic, to under 5 clinic, and the mother is supposed to carry the under 5 clinic card, because whenever the child is taken to the hospital, information is written on that card, and as a result, nurses and doctors are able to monitor the growth of this baby. So the child is taken for under 5 until it reaches, or she or he reaches, the age of 5. That's when they stop taking the children for under 5 clinic. So even when the child is sick, you know, like when it is somebody who is able to talk, they will say, oh, my head is paining, my stomach is paining. But a child, you are not able to tell. So whenever they are taken to the clinic, the doctors are able to tell if the child is sick or the child is not sick. And with the experience that nurses and doctors have, they are able to tell. When they see the child, the eyes looking maybe yellowish, they will know what disease it is. And in that way, they are monitoring the growth of their child. And this also even reduces infant mortality rate. Okay, so we've come to the end of our topic called nutrition. So we have some questions that we need to answer. I'll be giving you a few seconds for you to answer. We'll start with question number 1. A child is lacking proteins in his or her diet. What deficiency disease will he or she suffer from? Very good. It's kwashiorkor. When you are not having proteins in your body, you can suffer from kwashiorkor. Number 2, give 2 symptoms of rickets. How does a child having rickets look like? Very good. So one of the signs is maybe bowed legs or knocked knees. And also another one is that the child will be having, the bones will be having pain. So bone pains. Very good. The last one, state one importance of taking a child to under 5 clinic. You are right. So one of the most important things is that when you take a child to under 5 clinic, they are able to monitor the growth of the child. They will be able to give advice to the mother if the child is growing properly or not. And also they can immunize or give medicine to prevent some diseases such as polio. Sometimes they also offer free mosquito nets so that children cannot suffer from malaria. As you know, malaria is one of the most dangerous diseases that affect Africa. So ciao ciao, we shall meet next time. Don't forget to like, share and subscribe to Angie Academy.